So when you are seeking a comprehensive kind of dental care, biological care, a holistic care, what a patient is seeking is what is optimal, what material would be optimal for their body. Everybody is different. We like to do DNA testing to find out what is the kind of microorganisms that are in the mouth. And also we like to do biocompatibility testing because that's an opportunity for us to find out what would be better for you as an individual. There's materials that are more compatible with you, and there's materials that are compatible but maybe too weak for the amount of tooth structure being replaced. So there's a lot of things that you take into consideration when you're doing a building. If you're doing a 6-story building, you're going to have a better foundation. So we start with the foundation of the gums and the bone, and then we go into the quality of the materials. There's 5 categories of materials that are available to most dentists in the world. And we have, the amalgam, mercury, we have the plastics, we have the porcelain fused to metal crowns, we have zirconia, and we have gold. So from there, we have thousands of different bondings and cements. God made the perfect one. Which one of these available to men in this time in history would be better for you? So everybody's different. So we would have to analyze that, and we do blood work for that. When you come in and see us, we're gonna do about 30 photographs, and we're gonna do a 3-dimensional cone beam and also 18 x-rays. So we're going to see you from a photographic point of view, 3-dimensional, and we together as a team, you and us, we're going to look at all this data, and we're going to see if the restorations that you have that are existing are in good condition. So if you have a material that's broken, being plastic or amalgam or metal, whatever it is, you're going to have the opportunity to replace them, but now with a more mindful option that would be more compatible to your body. So if we see something that's defective and you choose to replace it, we have the option to choose from a menu that you're going to know the advantage and disadvantage of each different material, because there's no such thing as a perfect material. Very rare, but it's available. And if somebody doesn't have concerns about galvanism or MS, or they don't have any neurological problem, gold is king. It's the most expensive restoration. Some young people choose it because they want to be done. If you have gold, you're done. That's not going to rot, that's not going to break. It's very rare. It might last you 50 years. There's different kinds of gold and gold alloys. And for example, I had a patient that the only thing he could get is gold, because he clenched his teeth to nothing and he had only room for gold. Gold can be very thin. Well, there's 5 categories of materials, and gold is one of them. When we do biocompatibility testing, if you have gold as an alternative, there's different mixtures of gold and different alloys of gold. The uses of gold is some patients do not have any space for any other material, because they have a limited amount of space for material, and gold is the thinnest material that we can place in somebody's mouth. I have done gold restorations for 40 years. My father has a bridge of gold, and he has had it since he's 55 years old, and he's going to be 90 years old. So he has had it, it's in perfect condition. I have offered to replace it with zirconia, and he's like, why? It's perfect. So the safest material that I can offer a patient is the material that their blood work says that they're compatible with. So as a patient, if you want to know if the materials that you have in your mouth are compatible with your immune system, the best way to know that is by getting blood work and getting a report and compare it to what is it that they placed.